Hello, hi everyone. Today we are going to learn about analytical method validation part 3. Before going to the topic, I have a small request. If you like this video, please subscribe this channel, like and hit the bell icon. Please share for others. Let us go to the topic. Analytical method validation part 3. So, which parameter is the mother of analytical method validation? Means which parameter is the very important during the analytical method validation. Let us discuss which is the major parameter. So, in the previous videos we have discussed regarding 6 guidelines which describes how to perform analytical method validation. Those are ICH guideline, FDA guideline, IP guideline, USP guideline, UNODC guideline, ANVISA Brazil guideline. All these guidelines explained regarding analytical method validation. In the previous video, we have learned about how to perform validation and what is mini validation, which parameters shall be performed during the validation and mini validation. Specificity or selectivity, precision, repeatability, linearity, detection limit, quantitation limit, range, intermediate precision, accuracy, robustness, stability, reproducibility. All these are we have discussed in the previous videos. Above 6 guidelines, these are the method validation parameters which shall be performed for 4 different types of characteristics tests. Those are assay, quantitative test impurities, limit test impurities and identification tests. Let us see one by one. So, assay test, we have to perform all the parameters except detection limit and quantitation limits. Here we have discussed in the previous video, if you are given S means we need to perform that particular validation parameter. If you are given no, there is no requirement to perform the particular parameter during the analytical method validation. Coming to quantitative test impurities, only one parameter are not required to perform during the method validation, which is detection limit. So, coming to limit test for impurities, in this type of test category only 2 parameters shall be performed, specificity and detection limits. Coming to identification test, in the identification test we have check only one S is available in the specified area, means specificity only can be performed during the validation for identification test parameters. So, our current topic, specificity and selectivity, for which type of test categories these specificity shall be performed. If you check all the test types, specificity shall be performed, means for assay specificity is required, quantitative testing impurities specificity is required, limit test specificity is required, for identification test only one parameter specificity is important. So, let us see what is identification test. Some of the examples are given here. identification by visual test, identification by NMR, identification by MR, identification by GC, identification by GCMS, identification by UV, identification by HPLC, identification of LCMS, and the final identification of IR. These are the tests available for identification test with different techniques. Let us check for assay. For assay, assay by potentiometry, assay by titrometry, assay by HPLC, assay by LCMS, assay by GC, and assay by GCMS, and the final assay by UV. The assay test can be performed by these type of different techniques. And coming to quantitative impurities, these are related to related substances by HPLC, related substances by GC, related by compound by HPLC, related compound by GC, purity by HPLC, and purity by GC. These type of test category will come under the quantitative impurity categories. Coming to limit test impurities. Limit test impurities are like that: acetic acid content, benzene content, carbon tetrachloride content, sodium azide content, genotoxic impurities content, and impurity of any raw material contents. So limit tests generally performed for as per the regulatory requirement or skip testing or very rare conditions. So these tests are performed only two parameters, which is specificity and detection limits. Next, specificity and selectivity. As per the guideline, specificity is the ability to assess unequivocally the analyte in the presence of components which may be expected to be present. That means the separation between the impurities from principal analyte. So let us discuss with one example. In one chemical reaction, we have take phenol. By using phenol, we will prepare salicylic acid. By using salicylic acid, we will prepare aspirin. So why I have taken aspirin as an example? During our post graduation, some of the persons may perform during their laboratory practicals. So we will discuss by using this aspirin as an example for explain specificity and selectivity with different categories of tests. So which are the tests are present in aspirin? So identification by infrared spectroscopy IR, identification by HPLC, these two coming under identification test category. Assay by HPLC comes under assay test category. Performance test by dissolution comes under dissolution test category. Free salicylic acid content by HPLC will come under quantitative test impurities. So these type of test categories already we have discussed in the previous slide. Let us go one by one. The first parameter, identification test of aspirin. So actually identification test they are given in two types. One is identification by IR and identification by HPLC. First we will see how to perform identification by IR during method validation for specificity parameter. So as per the limit, specification is given as IR spectrum of the test sample should be matched with standard spectrum. That means, so we need to compare both the spectrum of test sample and standard of aspirin. So let us see the chromatograms. Let us see the spectrums. So if you check the tests given for aspirin is identification by IR, identification by HPLC, assay by HPLC, dissolution and salicylic acid content by HPLC. That means only one test contain one impurity, which is salicylic acid. So that salicylic acid content should be separated from aspirin. So let us see how to differentiate salicylic acid and aspirin. So if you see these two spectrums, around 3500 to 3300 there is a different peak in the lower spectrum, and around 1800 there is a different peak observed in the upper side spectrum. Let us see what is these two. So in the salicylic acid there is OH group, and in the aspirin there is COCH3 group. For in OH there are one different peak available around 3500. For coming to aspirin, there are 1800 centimeter inverse peak is available in the upper side spectrum. So by using these IR technique, both the spectrums can be separated. If you have the impurity of salicylic acid in the aspirin sample, then the correlation will be failed. So hence we can separate if there any impurity available in the aspirin. So by showing these two spectrums with different wave numbers, they are differencing with different wave numbers 3500 and 1800, we can prove that specificity can be performed by using identification by IR. The criteria is the separation between impurities from principal analyte. Coming to next test parameter. So identification by HPLC is one more test given in aspirin USP monograph. The specification is given as the retention time of the aspirin peak of the sample solution corresponds to that of the standard solution as obtained in the assay. Means this identification by HPLC can be considered from assay by HPLC method. So we need not to perform identification by HPLC validation. So it can be taken reference from assay by HPLC test. So specificity parameter of this test will be performed in assay by HPLC test. Coming to next test, assay by HPLC. As per the monograph, assay by HPLC limit given as assay of aspirin is 90% to 110%. During this validation, we need to perform the specificity by using salicylic acid and aspirin. Separation we need to prove, since salicylic acid content is the one more test available in the monograph. So during the assay, the specificity shall be demonstrated between aspirin and salicylic acid. So for proving this specificity, we need to prepare individual solution of salicylic acid and have to inject in the HPLC. The next, we have to prepare aspirin individual solution and inject in the specified method of analysis. By comparing these two chromatograms, the artist is different from each other, we can easily separate. So to compare this, we need to prepare mixture of solutions, mixture of both solution, and compare the retention times of aspirin and salicylic acid. By these chromatograms, we can see both are in different retention times. Coming to next test, free salicylic acid contained by HPLC. Specification is not more than 3%, means salicylic acid should not be more than 3% in the aspirin. As per the monograph, method of analysis of salicylic acid contained by HPLC is similar to method of analysis of assay by HPLC. The criteria of specificity is the separation between the impurities from principal analyte. So salicylic acid, aspirin are separated in HPLC, assay by HPLC method. The specificity parameter of this test can be take the reference from the assay by HPLC. If you want to do separate study in this validation, you can perform by using 3% of salicylic acid solution individual preparation and 100% of aspirin individual solution, and blend we have to inject and compare the retention times of the salicylic acid and aspirin. So till now we have observed only one impurity having the specification, that is salicylic acid. If you have more than one impurity in the specification, then we need to prepare each individual impurity separately, separate solutions, and blend solution, inject all the solution and compare the retention time of all impurities. So as per the below chromatogram, the principal peak was separated from other all impurities. So this is the criteria for specificity. All the impurities should be separated from principal peak and each other. Here one more important topic is peak purity of all known impurities, and principal peak should be passed. So peak purity means that under there is no hidden peaks available in any of the impurity. So by using spectrum we can compare the peak purity of all the impurities. To prove the peak purity, we need to analyze the sample in PDA detector instrument only. So without PDA detector we cannot prove the specificity and peak purity of all impurities. Hence, if you want to do validation and the parameter specificity, you should be analyze the sample with instrument which contain PDA detector. And another important topic is, if you have the residual solvents method in the specification, but actually in aspirin monograph there is not specified in any residual solvents method. Since all the monographs cannot be contained, or they will not mention residual solvents in the any of the monograph. Why? Because each company having different route of synthesis for different compounds. So based on their routes they have to perform their residual solvents analysis. Hence monograph does not contain residual solvents method anywhere. So if you have the residual solvents method, the separately inject each solvent individually and blend of all solvent in one chromatogram, similar to above said procedure. So compare all the each individual solvent with blend of all solvent. So if you check these chromatograms, first and second chromatograms RTs are nearby. When we are observe these two, we will feel that these both may be overlay or merge with each other. Similarly, third and fourth. But in the blend spectrum, we are easily identified that all the four impurities are separated by each other. Hence, we should perform the blend solution during the specificity analysis and compare the retention type with individual solvents. Here we cannot check the peak purity of any of the solvents since gas chromatography does not have any spectrum or any nanometers. Hence, in the residual solvents, the specificity can be proved by using retention time variations only. If your residual solvents method contains toluene, then you need to inject toluene sample in related compound by HPLC or related substances by HPLC or assay by HPLC or salicylic acid content by HPLC. If any of the test parameters which performed by using HPLC technique, that should be the toluene should be analyzed in that particular method of analysis. Do you know why? Since toluene having double bonds, that means HPLC detector UV or PDA can detect oxochromes and chromophores. Hence, if you residual solvents contain toluene or any other oxochromes chromophore molecules, then we need to perform these solvents in the HPLC method of analysis and we need to prove the separation from all other known impurities in the HPLC technique. So this is the major important topic in the analytical method validation, and specificity is the first parameter we need to perform in the any of the analytical method validation. If one of the impurity is merging with other, the specificity will be failed. Hence, before start the method validation, the first parameter shall be performed analytical method validation of specificity. Hence, specificity is the mother of analytical method validation. Hope all you enjoyed this video. If you like this video, please subscribe my channel, share, like and click on